So the main advantage of proton beam therapy over photon or X-ray therapy is that we treat less normal tissue. And that's because X-rays travel into tissue, treat a tumour at depth, and then travel out of the body, irradiating further normal tissue. Protons, due to their particle nature, travel into the body, so do treat some normal tissue, treat the tumour, but then don't deposit any further energy, and therefore you can see that it treats less normal tissue. This is particularly important in teenagers and children because this will reduce the burden of late side effects that they often carry once we've cured them. So the fact that proton therapy treats less normal tissue means that if you have a relatively radio-resistant tumour, i.e. you need high doses of radiation to cure the tumour, but that tumour sitting next to normal organ that is relatively radiosensitive, it is very hard to get conventional radiotherapy doses into the tumour and preserve that organ function. Protons is able to do that, and for that small cohort of patients, so those are patients with chordomas, chondrosarcomas, particularly in the base of skull or the pelvis, we actually increase their rate of cure as well as decrease their late effects.
So every patient in one of their first visits to our centre has their own specific immobilisation made, so it's bespoke to the patient, and this may be in the form of a mask, and that we'd use the mask if we were treating perhaps a lesion in the brain or in the head and neck area, or it might be in the form of something we call a vacuum-formed bag, which actually fits snugly around the patient and maintains the same position every day for their treatment. Once we've positioned the patient, we use laser lights to align them to predefined marks to make sure externally that they're in the correct position. But what we really need to understand is what is happening internally. And in order to do that, we take images every day. So it may be 2D images looking at bones and a little bit of soft tissue, or it might be CT equivalent images which allow us to look at three-dimensional anatomical pictures, and we can then ensure that there's been no changes from one day to the other in patient position or changes in the patient's anatomy.